My name is Dr. Paul Lederer, and today I'm here to talk to you about vision and traumatic head injury. I think when we see traumatic brain injury in individuals, we realize that when we look at visual function, we can see many kinds of conditions or symptoms or visual presentations, such as visual field defects, perhaps double vision. A number of these things are quite blatant and obvious, either in the assessment initially of the injury or to the patient's awareness of constant double vision or intermediate double vision as demands are extended in the visual array. Now, one of the things that often occurs also is that there's an array of hidden visual symptoms that often surface in these conditions secondary to these injuries, and that these conditions are not as aware of standing out like a sore thumb. Part of them relate to the inability to sustain reading for long periods without loss of place and fatigue, and the tendency to space out over time where you start losing comprehension. The inability to stay in focus and notice blurring of sight or a shifting of blur when going far to near, or even the inability to selectively ignore flickering lights, visual motion sensitivity of unexpected movement in their periphery. These things play a major role in their performance in their everyday life, and yet often this is not reviewed with the patient to assure that these are conditions that are secondary to the injury. They often think perhaps I'm not getting comprehension because of a higher cognitive issue in brain function, and yet sometimes it's an input system of eye teaming and focusing that can be addressed effectively through either correction or compensatory aids of glasses or the use of prisms that can improve their life and improve their performance. Their awareness at the initial exam that these symptoms are part of their condition gives them a sense of understanding that I see a settling in their face, that now they understand that somebody is asking the right questions of what their experience is in their daily living. Now, some of these conditions can be addressed by vision therapy, and eye teaming and focusing issues can be dealt with, even the inability to selectively ignore the visual orientation of motion and visual flickering lights around them. Sometimes treatment involves not just the use of interventions of vision therapy, but can use of lenses and prisms, such as lenses that reduce focusing effort, prisms that help maintain their alignment of their eyes, prisms that also give them the ability to be aware of the visual field that they're not seeing, expansion prisms, the awareness of techniques that compensate for these conditions, yoke prisms that shift visual space and seem to give them more security in the way they see, the ability of chromatic tints that decrease motion sensitivity. These are tools that we have at our fingertips to use and to investigate what in your specific case is the need that you have, your friend, your child's specific needs, so that therapy is not addressing all issues in all people. It's specifically geared to a cause and effect relationship between your findings, what your particular condition is, and the way in which vision intervention should be addressed to specifically vector its energy toward those issues that provide the most gains in performance and efficiency and in a self-worth, that things are going to get better in some ways. And this is what's important about what we do, is to help people achieve the most they can, to compensate for what we can achieve, and to spin the perspective on life in dealing with conditions that are always not totally treatable, but to gain improvement is to really gain 100% gain relative to where they are at that time.